Welcome to yet another episode of Mommy Talks with me, Catherine Karong'o. Today we'll listen to the inspiring story of Beth Wangechi, a wife and a mother of two who has lived with pregnancy-induced heart failure since 2014. We'll also be joined later by Dr Mzee Ngunga, a cardiologist at the Aga Khan University Hospital, to tell us more about pregnancy-induced heart failure, what it means, and how you can live a full life with the condition. Although in the last 2 months of her pregnancy, she would struggle with shortness of breath, Beth Wangechi never took it seriously. She thought it to be normal pregnancy fatigue until 2 weeks after childbirth, when it became unbearable. This was in 2014.
What now raised the issue is one day I came from, we used to live in a flat, so as I'm going down the stairs, the way you just decide, let me take a walk. Huh? I stood, I knocked at a neighbor's, we spoke, but at some point I couldn't breathe, completely couldn't breathe, and I told her I'm going to fall. But it came like for about 5 minutes and the thing went cleared, I was fine, we walked on. Then the second day I was going up a hill, going to buy food, and I couldn't even finish the whole journey. So I went back home. Finally, now the worst of it is when I started coughing. It's a dry cough. You don't have a running nose. And we decided, let's go and get this cold checked.
Beth sought treatment, and after a series of tests, it was confirmed that she had developed pregnancy-induced heart failure, a condition that commonly affects women who suffer hypertension during pregnancy. However, there is still a percentage like Beth who suffer the heart condition despite having a healthy pregnancy.
So we went to hospital. I remember that was at Mata. So we get there and the nurse checks. So I tell her I'm not able to lie flat. And she starts asking about my feet swelling. I'm telling her.
So your feet were swelling?
No, they weren't. So she's pressuring them and a finger. She's asking me, are you feeling pain? I'm telling her I don't have a problem with my feet. My problem is I can't lie down. I am having shortness of breath. And now I am coughing. So me now I'm down, baby, I just go home. And she tells me, no, I think we need to check further. So she sends me for an ECG. Then of course I didn't know what that is. So after the ECG, I remember the nurse asking me, is there anyone in our family who has an issue with their heart? I'm thinking, the heart who? So they check and then they tell me now, unfortunately it looks like your vitals are not very okay, so we need to take you to MP. So I decided, since I delivered at Aga Khan, and that's the hospital I've been going to for the longest time, let me just go there. At least I have a few people I know. It's more familiar ground for me to handle all this. So we sign transfers and we go to Aga Khan. It was at 6 going to 7. So we get there quite late. Yeah. So the doctor comes in and tells me, I was actually in the car, so my husband goes up, and when they saw the scan, of course, all of them. So they call me from the car after about 10-15 minutes. So as I come in, the doctor says, no, I meet now the friends we were with. And they tell me, they hug me. I'm wondering, you know, at that point,
what's going
I have no idea of the magnitude of issues I'm going to walk through. I am thinking, listen, Idawa. See, we just do an injection, you know, drugs, or, you know. I had no idea. And for some reason, I never even thought of finding out what it means to have cardiomyopathy at that point. So they hug me and tell me this is going to be a very long season, but we shall walk with you. At this point, no, I started now coughing completely. It couldn't stop. At some point, I couldn't even cough by myself. So my husband used to hold my ribs to help me now cough, yes. So at that point, we called the doctor and asked him, we are having a problem and it's really bad. I remember, I think it was at night. And he said, come to the hospital. You should have called me immediately. This thing happened.
Everything seemed okay until a month later when she went back for her review.
After a month, we went for clinic with my son. When we went for the clinic, my husband dropped us and left. So you know the way you normally go to the triage. Yeah. So that's where they realize all the vitals are actually going downstream from the pressure. Yes, the pressure was really bad. I can't remember how much, but I remember with oxygen I was at 52 or so, and at that point they're bringing a wheelchair. I mean, I'm thinking, Simi najitembeza, let me walk and go to there. They tell me I have to admit you. So that's when now we realize this thing is going south. And the doctor told me we're going to do inodrops. So I have no idea what inodrops are. So they put a line, which now is supposed to be feeding now the heart with drugs. And they tell me if the drugs, normal drugs, do not work, then we have to do this. So it got to a point where the doctor realized, by the way, we have done this, we have done an extra, I think 2 days or something, and it's not leaking. Then I used to get, they used to take blood tests every day. Now the doctor decided, we have done it, we already here, we can only do a CRTT device, which is a pacemaker, but now that has the what is it called? The shocking effect. So what it does, it helps your heart, it shocks you from both sides of the heart, and then it has a functionality that helps you, like when your heart, it realizes your heart is failing, either your heart rate has gone high or there's an abnormality, it shocks you the same way you're normally resuscitated. So now you feel that when you're standing, as you walk, or if whatever is happening at that point. And so we decided to go in. For 1.5 hours, I could not, they couldn't take me out completely, full anesthesia, because of the blood pressure. So they did a local anesthesia. I have never forgotten that injection, my God. It was 1 hour, 20 minutes or 45 minutes. And I think I cried through the whole time. Because they cannot give you full anesthesia to sleep, because if they do that, then the chances of losing you are quite high.
Upon discharge, part of the wound became septic.
Finally, the doctor decided, after now trying and trying and trying, your health is fine, but the wound is not healing. Leaving it septic right now means we could actually transfer the same to your heart, which will be more an issue, yes. So he decided to remove. And of course now, on this whole journey, I was the smiling part. By the way, you could come see me in CCU, and I'm wondering, why are you guys all stressed, by the way? I could smile, I could even pray and encourage all of you. But that day, I remember saying I have pneumochoka, by the way. So we had to remove, then give it 2 weeks. Then after the 2 weeks, then I insert the other one.
So in those 2 weeks, how was your heart operating? I
was feeling so normal. At some point, I almost told the doctor. By the way, I tried to convince them, see, leave this thing, I'm fine. I'm able to do this. The doctor told me, we have to do this thing, by the way. I'm not going to listen to you. We have come from far. I know we are here. We can't. We took 8 hours on the table. Safaricom has been that place where I call home, because I think if I was anywhere else, I probably would not even be having a job today. So they really took care of me. I was given half day to work during that period. And finally, we healed. The wound closed up. We came back to normal, came back to life, and moved on.
The jovial mom has now embraced her condition and is taking it one day at a time. All along, were you told what caused it? Because you had no history of high blood pressure. So
no. The doctor said it's pregnancy induced, which we didn't know, because we're wondering, so where did it come from? But he said it was pregnancy induced. You know, it's a learning process every other day. I think if you feel anything funny, by the way, go to hospital, get checked. There is hope. If we would do a support group or something, by all means.
Today I want us to discuss pregnancy-induced heart failure. Maybe you can start by explaining what exactly is it?
Yes, pregnancy-induced heart failure. Usually a diagnosis that comes as a surprise to the patient. And again, as I've said, it commonly comes as a surprise, not to the doctors, but to the patient. Because normally pregnancy is generally a time when many women enjoy good health. Occasionally there may be blood pressure problems. But usually when the mother has delivered, the symptoms tend to occur usually within 72 hours of the delivery in approximately 80% of the cases.
Apart from shortness of breath, what other symptoms present?
Very good question. So, really, the cardinal symptom is shortness of breath. Invariably, all the patients who develop this problem, what makes them come to the hospital is shortness of breath, because normally when women deliver, they expect things to improve because they have been having tired in the last week and they're like, oh, they have delivered and they expect the swelling of the legs to improve, they expect things to improve. And once they improve, for some reason, they tend to worsen over those next 72 hours that which is the median time in which they present. So the time can range from 24 hours all the way up to 6 weeks. And actually, the time duration of this disease in the definition is between the last month of pregnancy up to 6 months after you are delivered. If a woman develops heart failure or heart problems within that time, that is actually defined as heart failure related to pregnancy. So we give it all the way up to 6 months.
Is there a way you can distinguish between the symptoms of pregnancy-induced heart failure and those of a normal pregnancy?
Yes. Again, as you have correctly said, leg is indeed very common. And many of the times when it occurs in pregnancy, it is rarely a matter of concern. On the other hand, when these women develop shortness of breath, that's when you know something has changed. So the thing which tells you things have changed is that you may be tired, but that's normal, you can walk and do many things, but when you realize, oh, I cannot breathe, and especially when I lie down, I cannot breathe, I have to sit up, it means something has changed.
How do you treat the condition?
Yes, so again, as I mentioned, it's a disease of a surprise whenever it occurs to a young mother, and it has a very varying degree of severity. So some people it is a mild disease that occurs in probably a third of the patients, it is very mild, and that group of people you will find that the heart function is only slightly reduced. And usually the first purpose of treatment is to prevent congestion. Once you give them some medication to remove the water and the congestion reduces, the patients feel better. However, we still have to address the main problem, which is a weak heart. We do this by giving a combination of medication which makes the heart stronger, and again, this usually works over the next couple of weeks, months, sometimes years.
What are the chances of full recovery after?
So a very good question. So there's actually a very large study that we are conducting. It's called the Euro Heart Survey. We are part of it. It's actually trying to answer exactly that question. For a long time, the rule was the rule of thirds. It means a third recover, a third remain the same, and a third get worse. But our experience here states otherwise. It looks like majority of our patients recover. Probably more than 80-90% of our patients recover, almost to full heart function. Our observation and the result of that study will come out this year because we completed the data collection actually 2 years ago. So we are now following up the patient to see what happens. It will answer a very important question, which you are very likely to ask me. Can these women get pregnant again? So as at the moment, the recommendation which is there is, if the heart remains weak, as in the squeezing of the heart remains weak, and when I'm talking of weak, it means what we call the ejection fraction, which is one of the markers that we use to determine the severity of the disease. If it remains less than 40% or thereabouts, then we advise against subsequent pregnancies. On the other hand, if it improves to normal or almost near normal, then supervised pregnancies can take place. And of course, because we have also had scenarios where we have lost both mother and the child when we become pregnant. The mother gets very sick and she ends up in the ICU, have a premature delivery, and the baby also, and the baby dies and the mother also dies. So we have had those scenarios. So really, we have seen a lot of patients also. That scenario tends to happen a lot in people who feel they have become okay and they leave their hospital setup. So they feel I'm okay and decide to get pregnant. And then when they come back to you, you find they have not recovered fully. And now she is probably like 30 weeks pregnant. But the mother is very weak, the heart is very weak, and the baby is probably not mature enough, and then you end up in that kind of particular scenario. So it's always advised, if you have this problem, stay with your doctor. Sometimes I tell the mothers, it is better to stay with the child that you have that you have, and to risk for another one which you do not have, which may cost you your life and deny your other child a mother.
Your parting shot.
My parting shot is that it is very important for women to be aware of this rare complication. As I've said, it's not common. It comes as a surprise to many mothers because occasionally it may affect, again, as you said, it may cause them to be readmitted shortly after being discharged from the hospital. It may affect the way they breastfeed their children, again, and more importantly, it may affect their decisions to get subsequent pregnancies. The beauty is a lot of them recover with treatment. Without treatment, actually, on the other hand, most of them progress poorly. And we see people who may not do very well if it's not well treated. So I think awareness is important, and awareness is the first step, indeed, in prevention of bad outcomes in this particular disease.
See you again next week on Wednesday for another insightful episode where we'll be talking about pregnancy loss and how to grieve when you lose a pregnancy.
It's very right, it's very legitimate to grieve because we're just living in a society whereby, and especially for the initial stages of the pregnancy, maybe it was a miscarriage at about 6 weeks or 10 weeks, and it wasn't actually physically seen, and most of these families tend to suffer in silence.
Until then, stay safe and sanitize. Remember to subscribe to the channel using the subscribe button below, and also you could ring the bell so that you can get notifications whenever we upload new content. Thank you and goodbye.